A lot of people on Zoom waiting for us too. So thank you so much for joining this meeting. We're going to start this webinar on violence against indigenous women, afrodescendant women, and those from other ethnic groups with a traditional welcome from Juana.
Gracias. Hunimala shkri chiwete konogel chikamahun rutiliwet jingin hanitawaya paishi muleu chikamahun rutiliwet pakamiktir kep keme. Muy buenas tardes. Me voy a dirigir ahora en español.
Good afternoon, everyone.
Cada una. Primero que nada, saludar.
Afternoon, first of all.
Desde el conteo Maya, de la cosmovisión Maya,
I come from the Maya Cosmovision, and today is the Aikim Kopete Day, which is the day of our forebears. So I invite all of you, and I know that not everyone is prepared, but we can all hold hands. So first, I'm going to thank the Creator who gave us life and who created the universe, and call on Him to give us energy, and thank Him for giving us another day of life. The energy and death remind us that we are merely on this planet by passing. Sometimes we forget. Since we are busy with our day-to-day lives, we forget to give thanks. So today we thank our Nahau 2 or 3 times. We thank them for our life, the life of our family, and for this opportunity.
Mateo Shahau, Rikakaslem, Riwinaki. Gracias al Creador y Formador de la vida, por la vida de cada uno.
So I thank the Creator for our lives, the lives of each of us, and we thank all of our female ancestors for their lives and for their legacy. So today we're talking about violence against Afro-descendant women and girls. Let's remember that historically, we are those that have most suffered the greatest violence. So remind you of all of these women that left this life without receiving justice, without having been heeded, and who experienced life of many different types. We want to thank those who are here with us, and that leads us to reflect on the need to tell and create new stories so that that situation can disappear once and for all. So we thank our ancestors. The Western world tells us that we have to remember our departed relatives in November, but we in our Maya culture believe that we have to remember our ancestors every day. So we have ancestors, we have our lineage, and without that lineage, we could not be here. So again, thank you, thank you, thank you to our ancestors. And once again, I want to thank our ancestors for bringing us to this land and for having created the cities and the places where we live. Thank you.
We can continue with the video from the Assistant Director, Dr. Wanda Seeley.
Distinguished participants, experts and partners, colleagues, ladies and gentlemen, it is an honor to welcome you to this important dialogue and launch of the report, Violence Against Indigenous and Afro-Descendant Women and Girls, and those from other ethnic groups in the Americas, a cross-sectional analysis of the data. This event takes place in the context of the 16 Days of Activism Against Gender-Based Violence, an annual global campaign that begins on 25th November, the International Day for the Elimination of Violence Against Women, and ends on 10th December, Human Rights Day. We are here today because violence against women remains a devastating reality in our region, with enormous health, social, and economic costs. According to estimates from the World Health Organization, approximately 1 in 3 women and girls aged 15 years and over in the Americas have experienced physical or sexual violence in their lives. We know that even though all women can experience violence, some groups experience both higher risks of violence and greater barriers to access the support they need. Understanding the magnitude and diversity of risk and protective factors, as well as the consequences of violence against women, is the first step towards the elimination of all forms of violence. This includes increasing our understanding of violence against indigenous and afrodescendant women and those from other ethnic groups. Giving visibility to groups in situations of vulnerability is fundamental for developing and implementing more inclusive and equitable health policies, designing more tailored and responsive interventions, and ensuring that no one is left behind. This vision was underlined by Pan American Health Organization member states when they approved the strategy and plan of action on the strengthening the health system to address violence against women in 2015, and the policy on ethnicity and health in 2017. In response, and with the support of Global Affairs Canada, PAHO developed this report on violence against indigenous and Afro-descendant women and those from other ethnic groups in the Americas, which we launched today. The report would not have been possible without the fruitful collaboration of many representatives from indigenous, Afro-descendant, and other ethnic group communities, women leaders who inspired us to think out of the box, and experts who advised us on potential ways forward. It is thanks to you that we are here today. It is important to highlight that this report and dialogue mark the first milestone in a journey towards a comprehensive response to violence in all its forms, one that recognizes the intersections between the different forms of violence, the associated social determinants, as well as the women and girls that are most affected. This is just the beginning of a process that will require a sustained and truly collective effort where all stakeholders, from communities to decision makers, must be fully engaged. We count on all of you to help us give visibility to this important topic. Your experiences, your feedback, and your active participation during this dialogue and beyond are crucial, not only for making this gathering a success, but also for identifying the concrete steps we must take as a region to end violence against women and girls. PAHO stands ready to continue working with all of you and our partners to strengthen prevention and response capacities so that all women and girls in our region can live free from violence and enjoy long, happy, and healthy lives. Thank you for your commitment and for your collaboration on this important issue. I wish you a productive, inspiring, and enlightening discussion.
Thank you. This was the video message from Dr. Willie Thomas, the PAHO Assistant Director. And as you heard her say, this is a collaboration between 2 departments in PAHO and various other people outside the organization. So I'm now pleased to hand over for a brief welcome by the 2 directors, starting with Jerry Eichmann.
Thank you. Thank you, Brita. I'm also going to speak in English, so please maybe switch to Spanish at some point. Welcome. Welcome. It's really an honor and pleasure for us to welcome you here at this very, very important meeting where we talk about violence against women and particularly against those who are already so left behind, the indigenous women, the Afro-descendant women, and other ethnic groups that are affected. So as our assistant director already mentioned, this is in the context of the Human Rights Day and in the 16 days of violence against women. And I would even say just a few days ago, we had the World AIDS Day. And I would also say that this is also related because a lot of the violence, particularly sexual violence, has also consequences for HIV and AIDS, particularly among the populations we're talking about. So violence is one of the problems, the issues of our times, violence in general, but then in particular, violence against girls and women. And within that, it's very disturbing, very unfair, to see that there's this disproportionate impact on some women. Some women, because of their vulnerability, because of the way they are treated by our societies. And this is, as I said, very disturbing, and it goes against human rights. It is an issue of social justice. It is an issue of equity, and it is an issue in the end of public health. We cannot talk about health for all if we do not address violence against women, and particularly the afrodescendant women and indigenous women who are most affected. I just want to go back a few years and think about COVID, because COVID has really exacerbated, the situation, but not only exacerbated, also made it more visible. Where there was violence at home, where those situations existed and people could not leave their home or had to stay at home, obviously the situation became much worse. So we became much more aware. And I think that's one of the positive lessons learned, that we have to do something with them. So I do want to put the issue of vulnerability here on the agenda, caused by, as I said, the social determinants of health, the intersection between discrimination. Discrimination can be ethnic discrimination or discrimination against women, the exclusion, poverty, living in territories that are already vulnerable, where you have, for example, mining, where you have situations that make people even more vulnerable to violence. And then added to that is, once a woman has suffered violence, sexual violence or physical violence, the lack of services, the lack of health services, social services. And again, this is exacerbated by this discrimination of, even if they go, how are they received, and what are they doing with their complaints. The AD mentioned, and I find this such an important staggering figure, 1 in 3 women at some point in their life suffer from physical or sexual violence. This is huge. And it's something really we cannot, as I said earlier, talk about health for all or universal health if we do not address that. One other point that I want to highlight is that we need to take an intercultural approach, because violence is never a cultural practice. We should not accept it as a cultural practice. No, it is a violation of human rights. And I think this is something we really need to be talking about, putting it on the table, because too often we hear, but this is how we do things. There are even expressions in some of the languages and in some of the communities that talk, when I beat you more, it's because I love you. All this nonsense. Sorry to put it that straight. I think really this is extremely important that we have that clear. And then also the silence, of course, that is associated very often, in particularly in indigenous populations, it's associated with the shame, with the fear, with many other things that again are related to this vulnerability that we're talking about. Entonces tenemos estos retos enormes.
So we do face these huge challenges. So the question now, and I think that this is the most important thing, is, okay, what can we do about this? What can we do now? What do we have to do in the future? First of all, we have to make this visible. Brita has done a great job. I wanted to congratulate our team. We have to make it visible, gather better data that tell a story, so that we can put this on the agenda. It's a policy agenda. It's not a technical agenda. It's a human rights agenda. And we have to identify the causes behind the causes. Why does this happen? Why does it affect certain women, certain populations? That too needs to be known. Because if we do not understand this, how can we tackle it? And to begin, as part of what we have to do as the Pan American Health Organization, we have to work with the ministries of health, with health services, so as to find a place for this issue on the public health agenda. It is a matter of public health. We have to make certain that every woman who is raped, who suffers physical violence, she has to have the right to go to a health service where she will be treated with respect, be well received as we want her to be. So not only are these health services, social services, police, all of those things are interconnected, but for us it's tremendously important that we work at least with the health service to get rid of this stigma, where we work on capacity, but also the attitudes of our healthcare workers, so as to produce the change that is so sorely needed. Of course, we have to work with other sectors. We have to work with the community, and also at the local level, we need to understand the situation in each and every place. So we have a long road ahead. Those of us here have taken on this commitment, but I would ask all of you to help us change something. Let's begin by getting better data, and then let's take the necessary action. So thank you for being here, and thank you. I thank you, Sandra, Brita. I thank you for all of your good work, and I also thank the people here at the head table.
Thank you so much, Derry. And now I'll hand over to Ansem Hennes.
Thank you so much. Thank you so much for this welcome and for inviting me to be present here, Britta. So, friends, colleagues, ladies and gentlemen, I wish to extend on my part and part of our department a warm welcome on this muggy sort of day in Washington, and to you and to all of you who are participating here in the room and online. A lot has already been said, so I won't spend too much time extending it, and we're going to have a chance to participate, which I think is what this really should be about. As you may know, the Department of Non-Communicable Diseases and Mental Health that I lead coordinates the work on prevention of all forms of violence. And as you heard also from the Assistant Director in 2015, the region of the Americas was the first to adopt a regional strategy and plan of action on violence against women. When the ministers approved this document, they specifically included an indicator which draws attention to violence against indigenous women and girls, those of African descent, and other ethnic groups who often face a greater risk of experiencing violence while encountering increased barriers to access needed to support them, such as essential health services. So it's a lose-lose-lose situation, unfortunately. So I think really what we're hoping to achieve today is we want to work with you to give visibility to this important issue. The report that we launched today benefited from substantial interprogrammatic collaboration, engagement by regional experts, as well as advice from representatives of indigenous peoples and Afro-descendant groups. Without you, your efforts, your collaboration, your contributions, we would not have been here today. We would have achieved nothing, and this event would not have been taking place. So I really want to, as I said before, encourage you to use this space to actively participate in the discussions. Together, we can identify and work collaboratively on the concrete steps we must take as a region to end violence against women and girls. So thank you very much again for joining us, for your participation, and for joining us and accompanying us in this journey as we work with you to end violence against women and girls. Thank you.
Muy buenas tardes a todos.
Good afternoon, everyone. It's a pleasure to be here. First of all, I wanted to thank all of those who are with us today. We have people here in the room from Pajo, and also we have a high number of people connected, remotely. I have been working with my colleague Brita, and we have been working on this initiative, an interprogrammatic initiative. So first of all, I would like to reiterate our appreciation to the people who are here today. They have come, many of them from afar, and this puts a face on many of the conversations we have had leading up to the publication of this report. This was a very important initiative. It's something that is tremendously relevant. And it was not an easy job to write this report, but the report is now published. And here again, I call on all of us to reiterate our commitment. So with us, we have Juana Leticia Ovalle Tum, who opened this meeting with an ancestral ceremony. She is from the Maya Quiche people. She is a human rights defender in Guatemala, and she has worked with Bajo. Also, we have Carol Zabaleta Cortijo with us. She is a physician. She is a researcher from the Indigenous Peoples Observatory Network, and we are entering into a collaboration agreement with IPON Bajo, and they have been working on the priorities of Indigenous peoples, and that goes beyond this region because IPON is global in extent. Also, we have Samuel Samuels with us. He is a member of the National Coordination of Black Organizations in Panama, and he also worked with the ethnical unit of Panama. So we also welcome the people connected online. We have received a lot of questions. The selection was not random. We have been interacting. That is why these people are here with us. We have consulted many networks through the different countries, through our colleagues that work in the country offices of PAHO. So I would like to start this dialogue by asking you a question so that we can hear about your visions. What is the vision of the communities you represent? But what issues need to be tackled? What should we put on the table when we talk about violence against girls and women that are Afro-descendants or belong to indigenous groups? So we begin with Juana.
Sí, bueno, gracias por la palabra.
Thank you for giving me the floor. It seems to me that one of the most salient issues, as Dr. Sandra was saying, that has to be brought to our attention is that violence has been stigmatized in a significant way, and it is believed that violence is only physical when we speak of a beating and physical contact. But we have to consider what the other forms of violence are, and that exist against women and girls. We have to say that the UN has stipulated that women is one of the most vulnerable groups when we talk about violence, and indigenous and Afro-descendant women even more. It has been seen that they suffer more violence and discrimination more than the LGBTQ groups and people with disabilities. But at some point it was doubted because they said not only indigenous women are beaten, and we're not only talking about physical beating, we have psychological violence, and we have economic violence, we have verbal violence and many other types. So first of all, we have to make this part visible, talking about all possible forms of violence that we can suffer as women and as girls, so that we can take a look at that side of things, and on the basis of that, to develop different lines of awareness, and also to develop concrete actions in order to deal with these very important topics. But we cannot deal with something that is unknown and that is not just still mentioned. So I would consider that for starters. And I also believe that it is very important when we talk about indigenous and afro-descendant girls, the importance of intercultural dialogues, because looking at it from a different point of view, I consider the different types of violence, but maybe our sisters in a different indigenous group or afro-descendants see it differently. How can we find out through intercultural dialogues in order to learn about these perspectives and to be able to deal with them from that point of view? Thank you. Thank you very much, Juana. Would like to remind you that we have interpretation in English, Spanish, and Portuguese. There are a lot of people connected, so please just bear in mind. And thank you, Juana, for referring to the different forms of violence to reinforce the importance of the intercultural approach and intercultural dialogues in order to understand things from the different cosmovisions and how we live with these types of violence. Carol? Thank you very much, Sandra. Thank you very much to each and every one of you for participating in this meeting. And thank you for inviting me. Thank you to the North American territory for welcoming me, for allowing me to be here, for bringing me. I would like to highlight someone that was said by the director previously, saying that violence is not a cultural practice. I think that this is really important, and it is very important because something that I wanted to mention and to highlight is that we also have to take a look at things from the point of view of the community. How does violence take place? I'm a scientist, but in this intervention, I will speak as a woman that comes from an indigenous family and someone who's worked with indigenous communities. Thus, in the community, we have violence that comes in the meetings or clashes between cultures, governments, and policies that many times are not multicultural, intercultural, and that are not aware of the practices that prevail in the communities. For example, my grandmother was a farmer, and when she moved to the urban area or the area on the coast, she stopped being a farmer because she could no longer practice that work, so she became a poor woman. In that understanding of how we live in the communities and what happens when we move to other areas, these violence arise. And what happens with a woman that has indigenous knowledge in their communities when they leave or when they come into another culture or other policies that are not taking into account or that are not sensitive to these realities. It is at that time when we see the emergence of these clashes or these types of violence that are not necessarily physical. But now I speak as a mother, then these impacts will be transmitted to our daughters, because the daughters will no longer receive what we had, our connection with the land, our connection with the food, with the medicine. It will no longer be transferred to our daughters if we don't pay attention to that, or if the health sector or other officials don't remind us of this and they help us recover that so that we can later on transmit this to our daughters. Something else that I'd like to mention is within the communities. That's the other side of it. We, as indigenous families, have certain forms of educating our children. And within those practices, we also have violence. And it is different and difficult to talk about these issues because it is part of us. That is difficult. We also need spaces in order to talk about that, how we educate our children. And many times there are forms of violence in that. Also, it has to do with the practices that ultimately are understood or seen as sexual violence. And how could we educate our own indigenous authorities, our leaders, to understand that this should not happen? And this is what you were saying at the beginning. Violence is not a cultural practice. And recently in Peru, there was a huge discussion about the sexual violence against indigenous boys and girls. And to me, it has been truly painful, very painful to see that some authorities have said that these practices are cultural practices. No, these are not cultural practices and they should not exist. Thank you.
Muchísimas gracias, Carol, por esa
Thank you very much, Carol, for sharing your thoughts. So sincere and so close to the reality, and for things that are happening, and for bringing to the table things that are and issues that are really difficult to see and to understand. And definitely we fully agree. We cannot understand violence as a cultural practice. This is something that the networks have repeated, the media and many of the spaces that we've had. It is inadmissible. No type of violence is admissible. And we are truly aware of that. Samuel, please. Thank you very much. Good afternoon, everyone. Thank you for the invitation. Violence against boys and girls, afrodescendants, indigenous children is a serious problem in many of our societies, and it does need a careful attention and multidimensional attention. There are some aspects that when we talk about priority issues, we need 8, essentially. It is important to be able to work in each one of these areas. One is education and raising awareness, a strengthening of the legal frameworks, because it is important to have access to justice. If we don't have access to justice, we don't know how to fight for our rights. Comprehensive protection of support services in protection centers, in psychosocial attention services, which is very important. There are cases where there's a lot of trauma because of violence, and participation and empowerment that also helps these groups that have been attacked for many years, and the training of community leaders. And we're talking about the cultural approach. It is sensitive because a cultural approach in some cases faces some situations where the other person sees things in a certain way, and the way they think like that, they act differently, they discriminate, and they breach as citizens of other citizens. And we have to have that cultural respect, that knowledge in each one of these areas. And the respect for cultural diversity, which is something that we should be able to share. The involvement of community leaders, which is part of that process. Prevention of violence from early childhood. This is something that has to come from our schools, with our children. That negative speech that we've reflected in this, because we only talk about gender, and we typify it by slanting it to women, but we're talking about gender, and it includes both the different groups that we have in the 21st century that must be included, and they cannot be excluded or attacked. So we have to change those words, because sometimes we keep that discourse for years, and that same discourse continues to lead to these acts of violence and exclusion in a way. Research and disaggregated data, that is one of the main points that we don't have. No one wants to have data and statistics on violence in our countries, but it is a situation that we ought to have. And therefore, when I read and when I look at the whole set of situations and priority issues that we analyze and that we prioritize, we look at the policy on health that gave us 6 priorities, specific priorities in our state, in order to work with generations of evidence for many cases, because when we go to reality, these cases of physical violence end up in the health centers and hospitals, and they're not accounted for, they're not followed. And we don't work on a better policy for that in our states. So it is important. It does have an important component and a marriage at the issue of statistics and generation when we go to medical centers to know what happened in that community, what happened to that girl, that boy, that youngster, to be able to account for that and have evidence. And previously I was saying that we have to approach the ombudsman in our country. It is important that they also become a part of this process, because they will be receiving these statistics in order to be able to develop public policies and to be able to launch campaigns against these actions that happen in these areas. So they're partners, allies, and we have to sit down with them. And also the Minister of Education. I have to say this education from early childhood is important. We have to teach our boys and girls to mitigate these actions of racism and violence and discrimination amongst them since an early age, because we see these actions with the bullying that has picked up in strength in recent years in school centers in some countries, and we have to look for measures to put an end to this. I feel that also in intercultural dialogues, as was already mentioned by Juana, are very helpful. They're helpful in being able to come to the space of getting to know each other, to relate and to mitigate the different gaps that we have between cultures. One day, a young lady told us, afrodescendants, what is that? How do you eat that? We're in the 21st century, and someone has to ask what an afrodescendant is. So we have to talk to our people, because historic ignorance exists. Our history was not told correctly. It was excluded from our school books. So we have to provide the information to our boys and girls. It does bring with it this whole circle of history that we've received in our academic training in our school centers. That is why we have to work like this, and to be able to strengthen these cases, to make sure that our boys and girls are also protected verbally, orally, and physically in these negative actions that take place. Thank you very much, Samuel, for sharing these thoughts with this approach, intersectoral approach, to touch on several issues that are key, to work with ombudsmen, with education sector, and cultural diversity, respect. Thank you very much. And now what we'd like to do is to hear from you. How do you believe that the health system, and we've heard already some recommendations that obviously touch on this, but maybe a more emphatic way, how do you believe that the health system can strengthen the support for women and girls, indigenous, afrodescendants, survivors of violence? Juanita, please. Thank you. On the basis of what I said previously, it seems to me that the health system plays an essential role with violence survivors because of various reasons. First, because as I was saying previously, there's a type of violence that is psychological, and it does leave with you effects that have a direct impact on women. And so mental health, for starters, is a very important factor to reinstate physically and emotionally the people that are survivors, because it is of no use, for example, if a person survives or is able to live with a situation of violence, if they're going to live with that trauma for the rest of their lives. And it is there where we find that this is important when we talk about this health system for women, for girls, indigenous and Afro-descendants, that it has to be with cultural belonging. Because you, for example, the people that are not indigenous, have a way of having medicine and health services at work, and that's okay. But we have our own, because we have our cosmovision. In my case, for example, the Mayan cosmovision. So from the Mayan cosmovision, we have our system of beliefs. But what happens if this belief system goes against the Western system, for example? Instead of having clashes, that they would have to merge so that an indigenous woman or girl can have access to health, but cultural belonging, that it follows its beliefs, its context, and its belonging. This on the one hand, but on the other one, it seems to me that the health system plays an important role in the physical reestablishment, because many women that are survivors of violence also suffer some effect or some lesions or injuries that are very difficult to carry with you. So it is also important to give them that support so that they can enjoy full enjoyment of life and physical conditions. So health is one of the main pillars of life and one of the basic services. So it seems to me that this is very important for any reestablishment, and in the case of violence, even more. Thank you very much, Juanita, for emphasizing the need for focusing on the intercultural aspects of the health sector. AJO has the commitment of continuing to work with the ministries and obviously hand in hand with the indigenous and Afro-descendant organizations. Carol, please, any thoughts about this? Thank you, Sandra. Yes, I will say that there's a huge debt with our health staff and the training of our health staff in our region. It seems to me that the health sector is the time at which we finish studying and we will practice nurse, midwifery, medicine within the biomedical system, biomedical health. And we come to this space without necessarily knowing what has happened in recent history. And then in the distant history, North America, we know that indigenous women have been exposed to different forms of abuse, sexual, cultural, etc. But if we do a poll with our health staff in other countries in South America or in Peru, I'm not sure that we will acknowledge all forms of violence to which women have been exposed during the colonization times or the clash of cultures. And I'm talking about this because in Peru, we have the history of forced sterilization. And it is painful to talk about this, but I believe that it is important. We should not forget this. And to have a level of culture, to have a cultural level of being sensitive to this experience and can heal us and reconcile health systems. Intercultural dialogues are important. But before we have a dialogue, there's a whole work of preparedness, such as with education, with health, with other sectors, with the protection sector, to be able to acknowledge these experiences that we've had, which have had a direct impact on the life of our grandmothers. And then, as I mentioned previously, could have an impact on the life of our girls. Thank you very much, Carol, for bringing these issues, which are truly what brings us here today, because we're also commemorating the International Day of Human Rights, and to see issues where the communities have really suffered. I believe that this is quite relevant, and particularly to have an impact and insist on continuing with training in the health sector. Samuel, please. Some of you will not like it, what I'm about to say, but I have to say it. First of all, you have to raise awareness in our health centers. The one who studied to be a physician, a nurse, has a vocation. Only God gave it to you, nobody else. And you were given the opportunity to be a physician or a nurse, whatever. You must have human sensitivity when someone comes and looks for medical care. And that is the point of when we arrive in these medical centers. When we come to look for care, the first thing we receive in some cases is acts of discrimination, exclusion, bad treatment, the way they look at you, bad care. And we suffer. The afrodescendants suffer this, the indigenous people suffer this. Any citizen that goes to a health center, to these institutions, suffer this. I can talk about my country, but I'm sure that the same thing happens. But the issue of raising awareness is a priority issue. I believe that there's a very thin line where our ministries, our health ministries, lose that guiding light, not to know what sensitization and humanization is in providing care to our people, those that are insured or the people that come to look for health care. And something as respect for traditional medicine and inclusion as an alternative method for our people. Traditional medicine was not invented. It is historic. It is there. It comes from our cultural generations. It has a history behind it. It has more years of existence than the invention of health and science, so we need to include it. We have to acknowledge that this is such and to respect that it has an important space in our life, and it could also be an alternative within our healthcare. And I repeat, I have to say this once again, raising awareness, humanization, sensitization, that's the key to mitigate and leave these groups out for the groups that have been attacked for many years. Thank you very much, Samuel, for making us ponder upon the importance of recognizing and respecting traditional, age-old traditions, particularly in raising awareness in the health sector. Because of time issues, we will have another round of discussion with our participants. I'm sure that there are people here that have questions, so we will go to Brita, who will share some thoughts with us as a result of the report that is being launched today. Brita, please.
Very hard to follow this amazing panel. Yeah. So bear with me. Can you? Yeah, cool. Can you move to the next one? Yeah. I'm going to switch. Una de cada tres mujeres.
One out of 3 women, and I mentioned this, 1 out of every 3 women has suffered physical or sexual violence in their life. And these numbers are shocking. They're really impactful. But these numbers represent only the tip of the iceberg. These are the visible numbers, those that we know today. They're not all forms of violence. It doesn't include all the groups that we know of. So we're still missing a lot. But it is clear that the issue is a priority in public health, a priority in human rights, a priority in dealing with gender, a priority of health equity. We cannot talk about these issues without talking about violence. But I believe that giving visibility to this issue, to the data available, to talk about the magnitude, the risk of factors of protection, barriers, and access to support. And this is just a first step, because if we don't talk about these issues, then we cannot think about solutions because it is not visible. And in this context, we launched this study. And it is very much in line with the strategy of regional violence against women. Both emphasize the need for using information, using evidence in order to inform future steps or next steps. And the objectives of the report are, on the one hand, to describe the information available on violence against women, indigenous and afrodescendant women and girls, as well as other ethnic groups, from different sources of data, to talk about the lacks of information, what could limit or that is limiting, in fact, our action, and above all, to mobilize those stakeholders in order to delve deeper into the dialogue and give more visibility to this issue and to be able to think together about solutions. The methodology of the study includes different methods, different types of information. We have data on mortality, records, administrative information, population surveys. We have qualitative data, particularly bibliographic review, gray literature. We have reports from different organizations that we can find online, particularly in civil society. They do a lot in order to make it more visible. And the most important thing has been the consultation process, the dialogues that we held last year with the two groups, indigenous women and representatives from indigenous peoples and Afro-descendant women, to be able to interpret the data and the messages. It is extremely difficult to summarize the report. I don't know how many pages we have in this report, but only, first and foremost, I'd like to take advantage of this opportunity to express my gratitude to all those who participated in the process, because it seems to me that the process has been more important than the PDF that we now have online. Simply to have the opportunity to work with different authors, Gabriel Soledad, Amines Ortiz, who were the first dwellers in the first teams of PAHO in the country offices, who worked on the report, and all of the consultations that we held with representatives of indigenous women, indigenous peoples, other ethnic groups, Afro-descendant women who participated in different ways, the experts from different agencies who reviewed the form. It's been a 3-year process in order to arrive at this point. And I believe that the process is more important, and then future steps are more important than the PDF that you can read. And just to give you a couple of ideas, first, regarding prevalence. The report talks about 14 population surveys that we reviewed in order to measure the prevalence. But it talks about what is an achievement, because this is the indicator that we have in the regional violence survey. However, most of all, it talks about the gaps in the information, what we have. For example, the way in classifying or identifying different groups of the population in different studies. And then the ages are quite limited, and then the manifestations of violence. Obviously, most of our literature talks about sexual violence and gender violence, because these are the indicators that in the world targets and others, maybe they're not the most important, most prevalent and impactful forms of violence against indigenous women, Afro-descendants, and other ethnic groups. We know we don't have sufficient information about all forms of violence to be able to say what is more important or most prevalent. There's much more that we can do on this, and it is part of the SDE.
Just before, yeah.
Geez. This one, yes, good. Data on mortality and administrative records or registries. We found some examples of work that is being considered increasingly more ethnic identity in the recovery of the data, but we still have a long way. And yesterday, AHO launched a new toolkit for administrative data in the health system, which includes a specific recommendation where we talk about compiling and collecting administrative data on the use of services for survivors. We must have the capacity to include the self-identification of groups, to be able to have an idea as to who is using our services and what type of services do they receive, because if we do not have that information, we cannot talk about quality in the system. Next. Qualitative data. A key message of the report is that qualitative data are essential. Sometimes when we talk about violence, and this is something that we see, each person wants to use prevalence, mortality, quantitative data to talk about this issue, and I understand the interest. But when we talk about violence, risk factors, and consequences, qualitative research, gray literature, the whole work that civil society does on these issues to document cases of violence, but also to be able to talk or to explore or document solutions, many times led by communities. The work on mechanisms, ombudsmen, regional human rights, all this information is essential to be able to inform next steps. And an idea or a recommendation of the report has to do with improving the whole information, quantitative and qualitative information, but also to think of other ways of collecting information, for example, through the dialogues that you already mentioned. How can we give more visibility to this? Not only quantitative data and data on prevalence and mortality, obviously this is important, but also to think of other methods in order to collect and analyze qualitative data in order to inform next steps. And last but not least, the report also talks about visibility and policies on this issue. And these are data from a small study on the recognition of groups of women in multi-sectoral plans for prevention of violence. Multi-sectoral plans for the prevention of violence, that many times is like a key document in order to inform actions, interventions, and future steps to be taken by countries. Clearly, it is only one document, and a document will never be able to tell us what happens in practice. But to me, it is a signal. If in the written text of these documents that there isn't a lot of visibility of many groups, then it is difficult to know what happens in practice. Because if we don't begin with giving visibility to our words, for example, indigenous groups in the text of a policy, how do we know if in practice these groups are part of that reality and of the response? Then I believe that we have a good agenda in order to raise visibility of the needs and preferences of all these groups during the decade and the implementation of policies, protocols, and services in the health sector, besides promoting prevention comprehensive approaches.
And I'm about to conclude. I know that there are 2 or 3 takeaways from this report. First of all, the need or the importance of continuing to work on improving information across the entire spectrum. Also, we already know a lot. We know that this is an important issue, and it's not enough to say that we are missing some data. That is no reason why we cannot begin to implement action as of tomorrow. It's not that the lack of information, the shortage of information, that is no excuse for not moving ahead. We know it's important. We can take action. And this issue definitely requires a comprehensive response, including different sectors, different interventions. There are many areas in common across countries, and this requires communication with civil society organizations. And during the process, and in producing this report, we talked about social involvement. So with this issue, it's important that we consult, that we work, that we lead this work by working with communities in their entire diversity, so we know where we stand and what the next steps are. Now, I just want to say the report is available on our website. Please do look at the report, but in my opinion, this is the first of its type. It's the first time that PAHO has talked about this issue. The indicators, the member states set up indicators in 2015, and this has been a whole process to get to this point. But for me, this is a milestone. So yes, it is the first step, but it's also clear that there's a lot to be done. The idea behind the report is not creating an all-encompassing list of all solutions or detailing what information is available on this topic. No, but we have to create visibility for this issue. We have to create dialogues, set up consultation, participation processes. And if we don't do that, this issue will be ignored. So a lack of information or gaps in the information, that is never a reason for us to not be able to consult, to set to work tomorrow on this mission. And that is today's message. That's the idea behind this lengthy process, so as to be able to continue to work together on this issue. Thank you. Thank you very much, Brita. Thank you for your description of this report. And as you said, the idea is for us to continue to work together. So we have the commitment. We are going to be working with the networks in the region. And since we have some colleagues here in the room, I wanted to ask, does anyone have any questions? Questions for our three panelists? So I open the floor for the people here in the room before we go to the people online. Thank you. I am head of the risk reduction in Health Emergencies Department. First of all, I congratulate you on this report. Thank you for inviting me. And the work, indigenous knowledge in terms of reducing risk is important to achieve equity in health, which is a goal that we all share. We in our department deal with disasters. We were very involved in COVID. So what aspects do you think are relevant? What are the priorities? What needs to be worked on in the health sector regarding indigenous knowledge and reducing the risk of disasters? So my question goes to any of the three panelists. Thank you. Juanita, would you like to start? Well, you're talking about ancestral knowledge and disaster reduction, right? So I wanted to clarify that here I am speaking from the perspective of the Maya worldview. We consider that all environmental things are a result of human lack of consciousness. So when we talk about disaster reduction, disasters can be prevented, provided we're aware of it. For example, in Guatemala, without giving names of places, we have high mountains where they are cutting down trees. You don't have to be all that smart to understand that with a heavy rain, all of that dirt will come down, creating an avalanche. So from the Maya standpoint, we consider the holistic well-being. So we consider that Mother Nature, that we belong to Mother Nature, and Mother Nature does not belong to us. So if we belong to Mother Nature, we have to take care of our own house, because by taking care of our house, we're taking care of ourselves. So before you cut down a tree, we ask Mother Earth to give us permission to cut down that tree and to cause new trees to grow. So we, in our cosmovision, our contribution is understanding that we should not hurt Mother Earth. So to the extent that we don't harm the earth, we will be preventing disasters, because they're not going to occur, because we're taking care of our own house, our own home. And many of the indigenous peoples have this holistic approach to life. So since as human beings we're loving Mother Earth, that means that the disasters on Earth will not harm us. Yes, if I may, I wanted to respond to that comment, because my question definitely has to do with the topic for the afternoon. I'm talking about humanitarian aspects, things that occur in the region, in this region and other regions too, but also in the context of participation, leadership as a mechanism that can strengthen prevention.
Bueno, gracias. Voy a hablar un
Thank
poquito
you.
desde mi
I
experiencia
wanted to tell you a bit about my experience as a researcher, and I work in climate change and the health of indigenous peoples. I also work on food security. So in my experience during the pandemic, when we created the Observatory Network, back then it was called the COVID Observatory Network, we saw in the Ashani, the Shawi peoples in Peru, and then in India too. And that is something that we are doing with PAHO. We have an intercultural dialogue. There we saw that indigenous knowledge was very important, because they allowed us to have some foresight. So as Juanita was saying, we can more or less know where these climate events are going to come from. And that's important. In the case of the pandemic, experience with past pandemics, cholera, smallpox, other threats to health, that knowledge has not been lost. It was passed down from our grandparents. And what happened now during the pandemic creates knowledge that is also being shared, transmitted. So we did a quarantine, non-pharmacological measures to protect health. That is what we did in Western society, but indigenous peoples also have these same measures. So this is knowledge that is shared within the home, and they are context specific. Now, we also worked with an indigenous organization called Señoras de Olmesec, and they are beginning to protect bodies of water. So this type of thing. And the Oshawi, for example, they have different beverages that help reduce the presence of E. coli. So these are different indigenous learnings that can be made use of for extreme climate events and others. Yes, we had an experience in Panama when I worked in the ethnics unit, working with the University of Panama, the Ministry of Health, with the Pan American Health Organization, and with the Government of Canada that was involved in this process of access to vaccines. We did some surveys in some specific communities where indigenous and afrodescendant peoples live. And the result of that exercise provided us with good evidence about the percentage between men and women. In this case, men were less or relied less on the health care system. They didn't want access to the healthcare system or to vaccines. And that is something we learned from that survey. But I bring that up because I think that working with local governments, working with mayor's offices, helps us reach the community. It allows us to translate that health message. We think that health has to come to us, or that the sick person has to come to us. No, it's the other way around. Health care workers have to reach our population. They have to speak their language, because from the outside, you can't try to implement policies that no one is going to want to uphold. You can't go out trying to implement something that you have not discussed with the people. So you have to change this mentality. You have to increase participation, and it's the mayor's office, the local governments that have access to the populations. And this was effective. We were able to gather a lot of evidence and document a lot of things that, thanks to Canada, Aho, DC, they allowed us to share information on vaccines with the communities. We were able to also work with some faith organizations. So we had to deliver that information to others. They had to be provided with data, and we needed to talk to the general public about COVID. So you can do that. But if we want to have programs, if we have projects, and we begin by thinking that our authorities are going to implement that in a way it's going to be effective, if we don't work with the community, we won't be effective. COVID showed the world that there is no country that is assured good health. This is an opportunity to change the way that we view health. There is a country that I admired only in terms of its health care, not politically, no, and that is Nicaragua. Health is delivered to the community. That is an example that we all should follow. So health is the priority for the community in each and every way, and that's what we have to do. We have to respect the cultural and ethnic values of the people, and I'm very emphatic in that regard. We, in our administration, make certain that we train people that provided health support in our communities, because without information, without training, who can they talk to? And what could we talk to them about? And I reiterate, health policy has great strength. The thing is, there are some governments, there are some states that have not wanted to implement that. But there are affirmative actions that give us a lot of evidence to be able to mitigate some actions that affect health. That is generating evidence. We can say that we in our medical registry have the ethnic variable in our record keeping. That did not exist before. Now we're able to keep statistics related to different ethnic groups. That is now a concrete action. It wasn't possible in the past. So that improves our healthcare systems, and it also helps humanize our staff. Thank you. I wanted to give the floor to Dr. Jerry. I think that she has to leave. Yes, I really apologize. The director is calling me. I just wanted to say a couple of things. I think that we're going to need a paradigm shift. You're all saying the same thing using different words. We have to go beyond the averages. Averages tell us nothing. So let's say that there are 2 apples, I have both. So the average would be we each have 1 apple, but I have them all. So we have to talk about the mission. We have to talk about femicide. All of these issues have to be on the table so that we can tackle them all together. And also the other issue, another area where we need a paradigm shift is to assign greater value to traditional knowledge, indigenous knowledge, and not only Western know-how. I think that the pandemic showed us that what we have or have had in the past is not enough. You stated that quite well. Now talk about climate change. We have to approach this in the same way, because otherwise we're creating further gaps with people that have already been left behind, making them suffer even more. And this is the only way to assure the well-being that we all need. So thank you, and I apologize. Thank you, Jerry. I think that my colleague Oscar has a question.
Sí, muchas gracias. Muchas gracias por estar presentes y muchas gracias por la invitación.
Thank you very much for being here, and thank you for the invitation.
El tema que nos ocupa, el de violencia,
Our topic for the afternoon, violence, has two
explícitas de concentración. Por un lado,
areas of focus. First of all, ethnic relevance, indigenous relevance, relevance to afrodescendants, and the other perspective, which is important, is gender. So we're talking about violence, violence in women and girls of people of African descent, indigenous women, and we know that the tradition of violence, there is a tradition of violence in those two groups. And those are expressions of discrimination, exclusion, and other types of oppression that date back to colonial history. And as Dr. Jerry just said, one of our priorities, and you said that too quite clearly, one of the priorities is to take action against discrimination and exclusion. And I think that is not open to question. So my question is, in your experience, do you identify other social determinants of that deep-rooted inequality that means that there is greater violence against indigenous and African women? Things that are not exclusion or discrimination. That plus the fact that they are women, the gender component, that are areas that could be dealt with by taking action, things that we could do to minimize, attenuate, and hopefully eliminate violence against indigenous and Afro-descendant women. In other words, I'm talking about intersectionality. Include them in. Right, include them in. We chuckled. But that is an exclusion. It's verbal violence. And we have to change that. We have to change the historic rhetoric that hasn't worked. So let's look at people in the face. Let's see what the difference is. It's a paradigm shift. History tells us that every action taken today can produce different results tomorrow. So the time is now. So human beings should not look at, or human rights look at no faces. They are universal. They even include animals. So why are we excluding? Why are we separating? We all have to sit around the same table and begin to tear down the barriers that traditionally have led to situations that we often lament, and that should never happen again. Very interesting question, because there are a lot of ways to answer it. But what I would say is, for example, right now, I am an indigenous woman. I'm also an indigenous professional, so I slice it this way, because when I was an adolescent, then as a grown woman, I suffered discrimination. So what you're saying is very important, because of socioeconomic status, and I don't know why. And this is a question where I can say, I really don't know why most people think that being indigenous means that you're poor. That's an important topic. So I remember, and I'll share this with you, I had to move to the city so I could go to school. And I was in primary school, and I was taking a public speaking course, and I had to open a savings account. So we went to the bank, and they said, what are the requirements to open a savings account? And they were looking at us, and the requirement was that we had to know how to read and write. So you can see me, look at me. And all of the indigenous women in Guatemala wear the same type of clothes. But as soon as they look at us, they think that we're illiterate, that we don't know how to speak Spanish, we don't know how to read or write. So in our communities, unfortunately, in indigenous communities, we suffer violence because that is the norm. It is standard, even amongst women. We talk to women that are 50 or 60 years old, and they say, my husband used to beat me, but that's just the way it was. There we have what we call a pishaf, and it is a group meeting, and women would say to each other, well, you have to serve your husband. And the women that wanted to leave the community or do something else, they would say, she's a whore. So talk about violence against women. That violence has become standard, but we within our community suffer violence. And I talk about Guatemala. This has happened to us, and you probably all have stories to tell. I'll tell you mine, but I would go places dressed as I am. I would go to school, and they would say, you can't wear that to school. You have to wear your uniform. That's violence. And now as a professional, I am a trial lawyer, and I go to certain places, and once it happened to me, they said, are you the cleaning lady? Things like that. So your question is a very interesting one, because the truth is, violence also is a matter of social context. And I'm talking about the indigenous population. I am indigenous. I'm not speaking on behalf of the African descent population. So all of those cliches, all of those perceptions about the indigenous community are difficult. For example, at one point I put up a poster and I said, tell me what you have heard about the indigenous population. They're dirty. They don't know how to read and write. They don't speak Spanish. And other things too, all denigrating. So if that's what the social context expects, what can we expect in terms of our treatment?
And on top of that, so with the social and economic aspect that I brought up, and together with that, something very important in the case of Guatemala, women that practice the Mayan cosmovision. My mother is someone who counts time. She's a very wise woman. She counts time. And that is why she's discriminated against, because Guatemala is a very Christian land, and a lot of indigenous people, they say, oh, she's a witch, and I'm the daughter of a witch. Then there are a lot of issues that we have to see in connection with that. And regrettably, I say this regrettably because many institutions like Bajo have the will to do things correctly, and we're grateful for that. But there are other things that you cannot do that change, switching the mentality. That's a social thing, because in Guatemala, unfortunately, they relate cosmovision and our practices with witchcraft, and that's a reality. That is to say, the fire, the ceremonial fire. And so they're practicing witchcraft because they speak their language, and so they're talking to the devil. So all these issues that ultimately, this is how I see things as Juanita. I believe that when a person switches to another chip, it transfers this to another person together with your acts. Because it's of no use that I say one thing and someone else says it differently. If I change the chip, and with my children, with my nephews and nieces and the neighbor, they get this thing of living in harmony and not discriminating, we start spreading all these new ideas. And in the case of violence, I believe that this is quite necessary because since this is already part of the collective conscious, we have to see what paradigms I have, and then I can see whether I'm an individual that switches paradigms and prejudices, and then I can join society as a neutral agent and an agent that can bring about new and better changes. Thank you very much. Carol, please, we're bringing this to an end. Thank you very much. It is very important to pay attention to the question. And I would add something to this wonderful thoughts that are being shared by my colleagues is to demystify indigenous thought in health and education, the agricultural sector. I have been working on food security because it was difficult for me to work on health issues because for my colleagues the doctors to speak of indigenous knowledge, of indigenous medicine, of indigenous practices, as Juanita was saying, is seen as witchcraft. It is not seen as something serious. It is not seen as something that could be science. So I would only add that to demystify indigenous knowledge as something valuable and age-old knowledge, that if we don't know of it, then let's become acquainted with it, let's learn about it, and then we can express our views. Thank you very much, Carol. Well, thank you very much to the three of you. For us, it's been a privilege to have you here. It seems to me that there's no doubt that we have to repeat these spaces and these opportunities. We're grateful that you were able to come in person because it is not the same thing to hold this virtually. We will be able to continue discussing over coffee. So I want to reiterate our commitment. It is a sincere commitment to continue working on this issue of violence together with our colleagues in the area. And I'd like to give the floor to Dr. Ansem Hennis for the closing remarks. Doctor, please.
So panelists, experts, colleagues, ladies and gentlemen, it's really been an honor to be part of this historic report launch and panel discussion on violence against indigenous and Afro-descendant women and girls, and those from other ethnic groups in the Americas. And we really have to thank the panelists. I mean, for me, it was quite mind-expanding and eye-opening. I mean, I sat and I heard about things like the determinants, really told from a perspective of those who experienced it firsthand and could tell you. I mean, I can also give you my perspectives on these elements as well. But they spoke about things like the lack, the exclusions, determinants, issues of educational barriers, poverty, racism, early child marriage. They talked about issues too in terms of cultural perspectives and perceptions, often misinformed, which have become normalized in how people see things and how people respond to and how people propagate things that really lead to exclusion and discrimination. They talked to us about climate change, elements that are also very interesting. As you know, in the Caribbean, we have the issue of small island developing states and the vulnerability to climate change. But then again, Latin America and the Caribbean are probably the region with the second most natural disasters in the world compared to Western Pacific. So these are elements which are all really very important. And so the whole issue of giving visibility to groups in situations of vulnerability is really critical to developing and implementing more inclusive and response-oriented interventions. Violence is never acceptable, but it is clear that we must pay particular attention to groups at higher risk of violence or those who face particular access barriers to the support that they so desperately need. This vision was outlined by the PAHO member states when they approved the strategy and plan of action strengthening the health system to address violence against women and it really remains central to our vision of violence prevention today. This event has been especially timely as region marks the 16 days of activism to end gender-based violence, which is an annual campaign to give visibility to this important issue and its solutions. Let me reiterate that this report marks a milestone, but not the end of our joint journey towards a comprehensive response to violence in all its forms. I hope that this is the first of many dialogues on this very important topic. Now is the time for us to expand on this report to keep strengthening the evidence base of what works to prevent violence. And again, part of our discussion came down to data and information. And there's so much more work that needs to be done. We're actually now working to make the case that there are enough data sources that will justify indicators in gender-based violence at the highest level of being impact indicators for the organization. And it's an uphill struggle to do so. But we think this topic is really, really very important, and we'll really work to achieve this. Now is the time for us to reinvigorate our commitments and design and implement person-centered interventions that prevent and respond to violence in all its forms. Now is the time for the region to come together and lead action to prevent violence against women and girls in all their diversity. We stand ready to continue working with all of you and our partners to strengthen prevention and response capacities so that all women and girls in our region can live free from violence and enjoy long, happy, and healthy lives. Thank you so much for your participation, your contributions. I look forward to accompanying you on this journey to eliminate and end violence against women and girls. Thank you. And now the cafecito, the important part.
Hay un café ahora, para los que nos quieran acompañar, hay un café, no sé dónde está, Daniel, el café. No, ¿es afuera o abajo, no? Ahí, ahí es fuera.